A little itching, a little discomfort. A complaint that gets dismissed with, "She is probably fine." But what if she is not? What if the symptom you are ignoring today becomes the reason she suffers in silence tomorrow? Most parents don't realize pediatric gynecology exists. And that is exactly why so many warning signs get missed. Today, we're exposing the pediatric health issues nobody wants to talk about, but every parent should understand. Let's address something uncomfortable. Many parents believe gynecological care only becomes relevant during the teenage years. That is wrong. Completely wrong. Here is the truth. Gynecologic concerns can occur in infancy. They can occur during childhood. They can occur long before puberty. Yet countless families avoid the conversation because it feels awkward, or unnecessary, or embarrassing. And that is where problems begin, because children depend on adults to recognize when something isn't normal. They depend on adults to listen, to ask questions, to seek answers. The body doesn't care whether a topic is uncomfortable. Medical problems don't wait for comfortable conversations. And when silence replaces awareness, children pay the price. Meet Sophia. She is 9 years old, healthy, active, bright. One day she starts complaining about irritation. Nothing severe, just enough to mention. Her mother assumes it is temporary, maybe soap irritation, maybe laundry detergent. Maybe nothing. Days become weeks. The discomfort continues. Sophia becomes quieter, less energetic, more withdrawn. She stops mentioning it because nobody seems concerned. And here is the part that should make every parent pause. Children often stop talking about symptoms when they feel dismissed. Not because the symptoms disappear, because they think nobody can help. Months later, Sophia finally visits a specialist. The diagnosis isn't catastrophic, but it is real, and it requires treatment. The biggest problem wasn't the condition. The biggest problem was the delay. Nobody ignored Sophia, intentionally. They simply underestimated what she was trying to communicate. And that happens far more often than most people realize. Here is what makes pediatric gynecology different. Many symptoms seem minor: mild itching, discomfort, redness, discharge, pain, changes in urination habits. Most of these symptoms are not emergencies, but they are signals that deserve attention. Because children don't always describe symptoms accurately. Sometimes they lack the vocabulary, sometimes they're embarrassed, sometimes they're scared, and sometimes adults accidentally minimize concerns because they assume serious gynecologic issues only affect adults. That assumption creates blind spots. Blind spots lead to delays. Delays create unnecessary suffering. The real danger isn't panic. The real danger is neglect. Ignoring symptoms doesn't make them disappear. Ignoring symptoms only delays understanding. And understanding is where solutions begin. So why do pediatric gynecologic issues happen? The answer surprises many parents. Children's bodies are not miniature adult bodies. Different anatomy, different physiology, different developmental stages, different risk factors. That means irritation, infections, inflammation, anatomical variations, hormonal influences, and other conditions may present differently than they would in adults. And here is another truth nobody mentions enough. The internet makes this worse. Parents search symptoms, find extreme scenarios, become terrified, or they find misleading reassurance, become overly relaxed. Both responses can be harmful. The goal isn't fear. The goal isn't denial. The goal isn't denial. The goal is evaluation. Professional evaluation. Evidence-based evaluation. Because guessing isn't healthcare. Assessment is. Imagine your child complained about persistent ear pain for months. Would you ignore it? Probably not. Then why do so many families ignore persistent gynecologic symptoms? Because discomfort creates awkward conversations. And awkward conversations often become delayed conversations. But delayed conversations can become delayed care. And delayed care is rarely helpful. So what does pediatric gynecology actually do? Far more than most people realize. Pediatric gynecologists specialize in evaluating and managing gynecologic concerns in infants, children, adolescents, and young patients. Their focus isn't simply treatment, it is understanding symptoms. Understanding development. Understanding what is normal, and what is not. Many visits involve reassurance. Parents often discover that a symptom has a straightforward explanation. Other times, evaluation identifies conditions requiring treatment. Either way, families gain clarity, and clarity reduces fear. A pediatric gynecology evaluation may involve discussion about symptoms, medical history, development, hygiene practices, and other relevant factors. The goal is creating a complete picture, not making assumptions, not jumping to conclusions. Creating understanding. And that is incredibly valuable. Because uncertainty creates stress. Parents worry. Children worry. Families worry. Knowledge changes that specialists also help families understand prevention. Healthy habits, appropriate hygiene practices, recognizing warning signs. Knowing when symptoms deserve medical attention. And perhaps most importantly, helping children learn that talking about their health is normal. Not embarrassing, not shameful. Normal. That is a lesson that can benefit them for life. Because healthcare works best when communication exists. When questions are asked. When concerns are discussed. When symptoms are acknowledged instead of hidden. The earlier families become comfortable having these conversations, the easier future healthcare becomes. And that is one of the greatest benefits pediatric specialists provide. Not just treatment. Confidence, education, awareness, and trust. But there is one mistake many well-meaning parents make. A mistake that can unintentionally make children stop sharing symptoms altogether. And it is probably not what you think. Here is the mistake: dismissing symptoms too quickly, not because parents don't care, because they're trying to reassure. The child says something hurts. The parent says, it is probably nothing. The child mentions discomfort. The parent says, don't worry about it. Sounds harmless. Sometimes it is. But here is the hidden problem. Children learn patterns. If concerns are repeatedly minimized, some children stop reporting them. Not because they're better, because they don't expect help. That is the reality. Communication is a skill, and healthcare communication starts early. Children should know it is okay to report symptoms. It is okay to ask questions. It is okay to talk about private health concerns. Because embarrassment should never become a barrier to healthcare. The goal isn't creating anxiety. The goal is creating openness. Openness leads to communication. Communication leads to evaluation. Evaluation leads to solutions. And solutions improve lives. Now let's reframe this entire conversation. This isn't a story about fear. It is a story about awareness. Most pediatric gynecologic concerns are manageable. Many have straightforward explanations. Many can be treated effectively. Many simply require monitoring and guidance. The important thing is recognizing symptoms, asking questions, seeking appropriate care when necessary. That is it. Not panic. Not worst-case scenarios. Awareness. Think about the difference. Fear says, what if something is wrong? Awareness says, if something is wrong, we'll address it. Fear creates avoidance. Awareness creates action. And action creates better outcomes. The parents who make the biggest difference aren't the ones who know everything. They're the ones willing to listen. Willing to learn. Willing to seek help when needed. That mindset changes everything. If this video helped you better understand pediatric gynecology, subscribe for more evidence-based pediatric health content. We cover important topics that help parents make informed decisions and support healthier futures for their children. Leave a comment below. What pediatric health topic would you like us to cover next? Your suggestions help shape future videos. And if you found this information valuable, share it with another parent who might benefit. Medical disclaimer: this content is for educational purposes only and should not be considered medical advice, diagnosis, or treatment. Always consult qualified healthcare professionals regarding individual medical concerns and healthcare decisions. Thank you for watching. And remember, the most important health conversations are often the ones people avoid. The sooner we normalize those conversations, the better we can support children when they need us most.